Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We are glad to have you all join us this morning. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs, and I'm going to be your host for this morning. And presenting for us today will be Danielle Guillory and Gayla Yoakum. They're both community outreach specialists. Danielle is in Mississippi and Gayla is in Georgia. And today for the March installment of Webinar Wednesdays with SMP, we are going to talk about preventing identity theft. During the presentation, you're welcome to chat in any questions that you might have, but we're going to hold all of those until the end of the presentation. There's also going to be a prize drawing at the end. You had to have been registered for the webinar prior to 10:15 a.m. this morning and be present to win. Before we get started, we do have to let you know that this project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official Administration for Community Living policy. And for those of you who have never joined us before for a webinar, who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, like I said, from the U.S. Department of Health and Human Services and the Administration for Community Living. All grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And last year, we celebrated 25 years of the SMP program. Now, before I turn things over to Danielle this morning, we do have a quick polling question for you. And today's question is, how much do you think is lost to fraud, waste, and abuse in the Medicare program each year? And I'm going to go ahead and launch that poll. All right. There we go. So how much do you think is lost to fraud, waste, and abuse? And our options are, do you think it's $1 million a year? Do you think it's $60 billion a year? $500,000 or $10,000? And I'll give everyone just a few moments to make their selections. We've got about 50% voted, so we'll give it just a few more seconds. All right. I'm going to go ahead and close the poll and share those results with you. It looks like 67% of you said $60 billion a year. And here we go. All right, so you all did a great job because the answer is Medicare loses anywhere from $60 to $90 billion every year due to fraud, errors, and abuse. And that is billions, and I always say it, billions with a B. That is a lot of money. So I'm going to turn things over to Danielle, who is going to share some information on how that loss ties into identity and medical identity theft. Danielle?
Helps if I unmute myself. Good morning, everybody. Let's talk about the consequences to beneficiaries of Medicare fraud. So Medicare fraud affects all of us because our tax dollars are what pay to fund the Medicare program. Comes out of your paycheck every time. Fraud effects include the loss of benefits for beneficiaries. It may cause higher premiums, and identity theft, and of course, the billions of dollars that the program loses. Next. So what is identity theft? Identity theft occurs when somebody steals your personal information without your knowledge and uses it to commit fraud or other crimes. Next. So thieves see seniors as good targets for identity theft because many of you are more trusting than, say, our millennials are. Millennials don't trust anybody. We have a tendency as seniors to believe the best of people. And thieves think they can easily take advantage of us. They also may believe that the senior has a nest egg because you've worked all of your life, or a significant savings or retirement account. Next. So, how do thieves get to your info? They can get your info or information in many, many ways. Some of those include what's called dumpster diving, and that's when they'll go through your trash to look at your personal information that you've thrown away, maybe in your mail. Or skimming, and that's when they steal your credit or debit card numbers by using a device when you're skimming, processing your card at perhaps the gas station. And then phishing happens when they send you an email pretending to be your bank or a government agency asking you for personal information. And you click on that link and they get your information. And then hacking is when they break or hack into your email or other online accounts to access your personal information. And then just old fashioned stealing. Pickpockets steal wallets and purses, or they may steal your mail out of your mailbox. They could get your tax information or your credit card offers. Next. And so let's talk about phone scams. Another way that they might get your information is through the telephone by calling you. Or the FTC website lists a few common phone scams that they're seeing. An imposter scam is when a scammer pretends to be someone you trust, such as the IRS or other government agencies, the Social Security Administration, a family member, a love interest, or someone claiming there's a problem with your computer. And the scammer can even have a fake name or number show up on your caller ID to show you that they're local or they're someone you know. Debt relief and credit repair scams are a big deal, and the scammers offer to lower your credit card interest or fix your credit or get your student loans forgiven if you pay their company a fee. But you could end up losing your money and ruining your credit by doing that. Charity scams are when they pose as a charity. A common one here in Mississippi is you get the call that pretends to be the police department looking for donations, and they're requesting donations for disaster relief efforts, and those are especially common right now. Always check out a charity before you give, and don't let someone pressure you to give immediately over the phone. Free trials. A caller might call and promise you a free trial and then sign you up for products, sometimes lots of products, and then you're billed every month until you cancel, if you can cancel it. And then prize and lottery scams. In a typical prize scam, the caller will say you've won a prize, but then they say you need to send them some money to pay for the registration or shipping fee if in order for them to send it to you. But after you pay them, you find out there is no prize. If you receive any of these calls or offers, you should immediately hang up. Sometimes you can have these calls blocked by signing up for a service with your telephone provider or using call blocking apps on your cell phone. And don't trust your caller ID. Scammers can make any number or any name or number appear on your caller ID. It's called spoofing, and they even make it look like the Social Security or Medicare is calling you. Social Security and Medicare will never call you. Next. Computer scams and Facebook scams. Social media is the new way to go. The internet and social media websites such as Facebook are favorite venues for scammers to use to attempt in stealing your identity. Here we will touch on several scams that are popular that you should be on the lookout for. Next. Cyber criminals may try to interact with you on Facebook, pretending to be someone else, such as a friend or a loved one. Be especially cautious if this is someone is asking for money, gift cards, or personal information. They'll often pose as a loved one in a crisis who needs you to send them financial assistance immediately. Please use a known working phone number you have for this loved one or friend to contact them and see if they are really the ones speaking with you on the internet. Stop and call your family or your friends if they are pretending to be that person. These cyber criminals could be trying to get money or enough information from you to steal your identity. Next. The next scam we want to talk about is tech support imposters. Don't fall for messages, emails, or phone calls that claim to be from a tech support company telling you that your computer is infected with a virus. Tech support companies do not conduct calls like this, and the person on the phone likely has no knowledge if your computer is infected with a virus or not. These fraudsters will have you pay them money to fix your computer, all while gaining remote access to your personal computer, where they will snoop on your personal files, which may contain private information. They will then use that private information to extort money further from you or to steal your identity. Next. Let's go over a few tips to protect yourself on the internet. While there are many methods scammers use to attempt to steal your identity on the internet, here are some general tips you can follow to help protect your identity. Limit the personal information you share on social media. Avoid listing personal information like your birth date, hometown, or address. Create strong passwords for all your accounts. Nothing that can be easily guessed by strangers. Don't use your birthday. Don't use your kid's birthday. Don't use their names. Never share your password or your bank and credit card information with untrusted sources. Regularly check and manage your privacy settings on your social media, only sharing private information with trusted friends and family members. Beware of emails and messages claiming to be from official organizations such as your bank, the IRS, or Social Security asking you for personal information. They may even use a seemingly official company logo in the email, but you'll notice the sender address will be from a non-official email not affiliated with the organization they claim to be representing. Next. So what do we do if thieves have your information? What did thieves do when they have your information? Once the identity thieves have your personal information, they can drain your bank account, run up charges on your credit card, open new utility accounts, or get medical treatment on your health insurance. An identity thief can file a tax return in your name and get your refund. In some extreme cases, a thief might even give your name to the police during an arrest. Next. So preventing identity theft, how do we do that? Shred financial documents before you trash them. Shred receipts, credit offers, credit applications, bank statements, physician statements, and similar documents when you do not need them any longer. Keep your information in a safe and secure place. Lock your financial documents and other important papers in a safe place in your home. Keep information secure from workers who may come into your home. Protect your Social Security, Medicare, and or Medicaid numbers. When you go out, only take the necessary identification and credit cards with you. Do not carry your Social Security card, your Medicare card, or your Medicaid card unless you are going to the doctor. And never click on links in unsolicited emails. Don't use an obvious password. Opening a file from someone you don't know could expose your system to a computer virus or spyware that captures your passwords and other information as you type. Next. According to the FTC, we should all get into the habit of keeping tabs on our identity and personal information. They recommend the following 5 steps. Read your credit card and bank statements carefully and often. Know your payments due dates, and if a bill doesn't show up when you expect it, look into it. Read the statements from your health insurance plan. Make sure the claims that are paid match the care you got. Shred any documents with your personal and financial information on them. And review each of your 3 credit reports at least once a year. It's very easy to do and it's free. Next. And how can you tell if you've been a victim of identity theft? Unexpected credit card bills showing up, and you suddenly receive bills with purchases that don't belong to you. Denials of credit for unknown reasons, calls or letters about purchases you did not make, and charges on your bank statement that you do not recognize. These are all things that can tell you you've been targeted. Next. And what can you do if you've been a victim of identity theft? Place an alert on your credit bureau report. Placing a fraud alert on your credit report can make it harder for a thief to use your identity to open new accounts. And if you have a fraud alert on your credit, a business must verify your identity before opening up an account. So they may try to contact you if someone is opening an account in your name. Contact the company in which the charges were made in your name. Speak to their fraud department to dispute the charges. File a police report and contact your local law enforcement office to file that report. And report it to the Federal Trade Commission. Next. And so what is medical identity theft? And that's when someone obtains your personal health care information, Medicare or Medicaid number, your Social Security number, prescription drug card, or other medical identification to access your benefits. It also occurs when criminals use medical information fraudulently to bill insurance providers or government programs for medical goods and services that they have not provided. Next. So both individuals and healthcare providers suffer when thieves make fraudulent medical claims. Studies in previous years have estimated that medical identity theft costs the healthcare industry $30 billion a year and an average of $13,500 for each victim to resolve the issue. You can you can go to, I'm not sure what that is there. Never mind. Next. So how can I detect medical identity theft? There's several ways to detect medical identity theft, including the following. Read your medical and insurance statements regularly and completely, including your Medicare summary notices and your explanation of benefits, because these statements are considered the first warning signs of medical identity theft. When you're reading your Medicare summary notice or explanation of benefits, please look for the following items. Look at the name of the provider, the date of service, and when the services were provided. Make sure those are your name, your doctor, the correct date of service, and that you were seen on those days and what was done. Bills for medical services that you did not receive, calls from debt collectors about medical bills that you don't owe, medical collection notices on your credit report that you don't recognize, or a denial of an insurance policy because your medical records show that you have a medical condition that you actually don't have. Next. There are several ways to protect yourself from medical identity theft, including reading your Medicare summary notices and your explanation of benefits. Please remember that these are very important statements that hold a lot of your medical information. So you want to read these completely and thoroughly. Then shred all medical related documents after you're through reading and studying them. Keep accurate records of your doctor's appointments and medical procedures. If you have a personal calendar in your household, in your purse or your car, please remember, write down all of your appointments or keep the appointment cards from the doctor's office to remember what the appointment dates and medical procedures, so you are able to match those dates and times with your Medicare summary notice, your MSE, in or your EOB to make sure that everything is correct. Next. Now that you've learned about ways you can prevent identity and medical theft, I'm going to turn everything over to Gayla, and she's going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse by prevent, detect, and report. Gayla?
Thank you, Danielle. Danielle, that was some great information that you gave us. Today, we're going to talk about how to prevent Medicare fraud. So when we're doing that, we need to protect our personal information. And your best defense against healthcare fraud and abuse is to, 1, treat your Medicare and Social Security numbers like your credit cards. Never give these numbers to a stranger. Remember, Medicare won't call you, and no one should call you and ask you for your Medicare number over the phone. Medicare will never call you. Don't carry your Medicare card unless you'll need it for a doctor's appointment. And keep a record of your medical visits, tests, and procedures in a healthcare journal or a calendar. Next. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notices, or MSNs, or explanations of benefits, your EOBs, from your insurance company. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: charges for something that you did not get, billing for the same services or supplies twice, services that were not ordered by your doctor. Next. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, do not give out any personal information. report the call immediately to Senior Medicare Patrol at 877-272-8720. If you have any questions about your Medicare statements, please call your health care provider or plan. If you are not comfortable calling your provider or you aren't satisfied with their response, please call SMP. Next. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join our fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in a bi-monthly webinar and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we have had couples team up to volunteer, give presentations, and attend community events. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. Next. As we mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can also visit our website at www.stopmedicarefraud.org for additional information about our program. Additionally, we would like to encourage you to scan the QR code using the camera on your cell phone that will guide you to our social media platforms, including Facebook, Georgia, Louisiana, Mississippi, and Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcast. Sunny, over to you.
All right, thank you, Gayla and Danielle, for that wonderful information and teaching us ways that we need to be looking out to prevent identity theft. So I wanted to remind you all that coming up next month for Webinar Wednesday, we will be discussing genetic testing fraud. That's going to be our hot topic for the entire month of April. And the webinar is scheduled for April 26th at 10:30 a.m. Central Time. So now it's time for our prize drawing, and that means that everyone who was registered prior to 10:15 this morning has been entered for a chance to win, and the winner must be present, and the winner is going to receive their choice of a Walmart or Amazon e-gift card. So give me just one moment and let me share that screen with you all, and everyone that was registered prior to 10:15 today is entered on the wheel, and we're going to go ahead and give it a spin, and hopefully someone's going to be here. So it looks like Kevin S, and I'm looking through the list to see if Kevin is on with us today, and I don't see his name, so I'm going to take it off and we're going to give it a spin again. Angela J. Okay, unfortunately, I don't see her name. All right, and Miss Laphilia Johnson, and I do see her name. So congratulations, Miss Laphilia. I will be reaching out to you in just a little while to find out what kind of gift card you would like to receive. Okay. All right, so before we wrap up today's presentation, we wanted to open up the floor for questions. So if you have a question regarding the information we presented, please raise your hand. If you look to the right of your screen, you see a little hand button. You just click on it, and that way we can unmute your line and you can ask your question. Or if you'd prefer, you can type it into the chat. And I'm not seeing any hands raised or any chat messages coming through. So this will conclude our presentation on preventing identity theft. We will receive an email after the webinar today with a link to a short survey, and we would really appreciate it if you would take some time just to let ACL know how we did today. So thank you all again for joining. Be on the lookout for information on next month's hot topic, and we hope to see you all again soon. And thank you to our presenters. Thank you, Danielle and Gayla, for that great information. And we hope to see you all again soon.